My dear students, so today's session we are going to discuss what are the articles needed for the measuring of blood pressure. Dear student, we have discussed for the past class about what is the blood pressure and how to measure the blood pressure, what are exact sides of the blood pressure. So dear students, today we are going to look for this session what are the articles for measuring of blood pressure. As we know that the main article, the main tool which is going to accurate data of measurement of blood pressure is nothing but sphygmomanometer. So this is one of the tool, and second one is a stethoscope. As we know that the two kinds of the methods are there for checking of blood pressure. The first one is the manual method where we can do a pulsation of the blood pressure, and second one is called as auscultation. With the help of stethoscope we can auscultate and we can hear the sound of the pulse. By that we can understand how much the blood pressure exactly. So that is the second article for the blood pressure measurement tool. And next one is alcohol swab. Dear students, this is the swab not only for checking this blood pressure but also whatever procedure we are doing in a hospital setup, for everything we need to be use this alcohol swab. So what is the main purpose of this? For swiping, for cleaning, so for maintaining of sterile technique of this kind of stethoscope or something else, because for the prevention of cross infection. So that is a next tool is a receiver, is nothing but kidney tray. So after using of this whatever the things wastage we can throw it. So that is a receiver. And general waste bin, so this is the color code for using of general code as per our biomedical waste management within the hospital setup. So these are the articles I have explained. Next I'm going to go for procedure. So how the blood pressure. Before that I want to tell, here the thing is, here lot of the nursing students, lot of the nurses also still they don't know how to measurement of the blood pressure. It is how silly for us. So actual we need to know, as a medical student, as a nursing student, we must know what is exact location or what is exact step by step activities and what is the exact procedure of the measuring of the blood pressure. That I am going to discuss today, and you will get today exact meaning. And by using of sphygmomanometer, the procedure I am going to explain. The first one is pre-procedure. Greet and explain the procedure to the patient. Whatever the procedure we are going to do for the patient, the first priority, the topmost priority is introduce yourself, greet yourself and explain. That will be called as preliminary assessment. That would be called as preparedness. Yes, prepare yourself and prepare the patient also. So that is called as greet and explain. So and so Mr. Prasad, I am going to assess you and I am going to do some procedure for you. So that is the meaning of this first step. And second step is provide the privacy and hand hygiene procedure. So privacy is a very important as our nursing ethical measurements. So we must accept that the privacy is a topmost priority for the patient, because we know that there are the lot of the patients are feeling hesitate. The lot of the patients is not allowed to do some kind of procedures because you're going to do. In that case you must provide the privacy. Nothing but there is a privacy screen is there, you just go on it. So that is called as the privacy. Provide the privacy to the patient and go for your hand washing. Yes, this is also one of the priority you must do. So what is that? The before doing any medical procedure, as we know that the sterility is a very important in order to prevention of cross infection. So infection is the hospital acquired infection is the bulk in the hospital. So there is such a kind of bacteria, virus and parasite, lot of the things are the germs are there. For the prevention of the cross infection you must do the hand washing, because within the ward, within the ICU, within the operation theater you are going to touch that thing, this thing. In that case so much of infection is going to come for you are the factor who spread for the infection over there. That's what, for the prevention of such a kind of the infection you must go for hand washing before do any kind of the procedure, not only the medical procedure and not only for surgical procedure. So do this two kinds of the steps. And next one is position of the patient. Yes, not only for assessment of the blood pressure, not only for assessment of the vital signs, but also for any procedure, make sure the comfortable position of the patient. So for the checking of blood pressure, the comfortable position either sitting or lying. But the thing is, either sitting position or lying position, you must make sure yourself the sphygmomanometer, the BP apparatus must be at the chest level. The must be placed on chest level. It means not you are going to place on chest, but wherever you are placing your sphygmomanometer, it must be level of chest level. Then only you will get accurate blood pressure measurement for your patient. That is a very important point for your checking of blood pressure. And next one is the next exposed arm. What it indicates, why you need to expose to the arm, because in some cases for the some patients is having undergoing of some surgeries over arm, and some of the patients, those who are doing a dialysis patient, they have something here fistula surgery. In that case, if some people are having some injury bleeding, so in that case you should not go for this selection of this area. As I said for the last session, there is some other areas, some other kind of sites for the blood pressure checking. You can go for it. For that purpose, make sure that before you're going to check the blood pressure, exposed to the particular site. That is the very important for this. And next one is procedure. We can start. Before going to start the procedure, this is called as cuff. So this is the one of the part of sphygmomanometer. Make sure that or ensure there is no air in the cuff. Why? Because if there is air in the cuff, it is not going to give accurate data. It is not going to give accurate systolic pressure. It will give some error. In order to prevention of error, you must make sure that there is no air in the cuff. That is the main important you must do. And next one is, as I told you, place the things at the chest level. As I said, whatever you are going to do, the procedure at the lying position or sitting position, you are going to place your sphygmomanometer, BP apparatus must be at chest level. That is very important. So this is the way you can see the diagram. So this is the lying position of the patient, and you're going to place here. So I drawn one line here. This is a cardiac position. The cardiac position is nothing but chest position. So at the chest position it is going to place. Then only we'll get the accurate blood pressure measurement data. And next one is the procedure. So what exactly the procedure? Yeah. So here, how showing in the picture, so you can place one hand over the pulse sensation. So this is the method is called as manual method checking of blood pressure. So this is the way you need to place your hand over the palpation of the artery, is called radial artery, and this is the way you're going to bulb of air, and this is actual the things. So here palpate the radial pulse and pump until no pulse felt. So here the thing is, what is the demonstration I want to tell here. So it is, there is a bulb is there and you just pump it. So the first thing is place over the three fingers. Use the only three fingers while you're going to check the pulse. Not only radial pulse, every pulse when you're going to check, you must place your hand on three fingers on the artery. And next one is, you must go for here. So pulse it and palpate it. You will feel the pulse and you can pump it. Pump it, then mercury will get at high position. For suppose it is going to reach up to 200. And where you are not feeling sensation when it is going to up, in that case at one level you won't get pulse, is it? Then slowly you can come down, you can release the air slowly, and where at the what level, at what reading on the scale you're feeling a strong pulsation, that is the point of systolic pressure. Wherever you might face on 130, you might face on 140, you might face on 120. It's depending on the patient condition. You feel the strong pulsation, that is called as systolic pressure. And slowly you can remove the air, lose the air. Then at one point, at weak point, the pulsation will be disappear. Where the pulsation is going to disappear, that is called as diastolic pressure. One more time I'm telling you, just pump it. So at the top level, when it is going to not pulsation, yes, then when you're not feeling pulsation here, stop to pump. Then slowly you can relieve, and at one level it will come down, and at one level you will feel the strong pulse, and that you can note down, that is called a systolic pressure. And continuously you can slowly you can remove the air from the cuff, then it will show disappearing of the pulsation, that you can note down for the diastolic. Yes, this is exact procedure, accurate data you will get the measuring of this blood pressure. So after that you can remove the every articles, what is the things you kept here. And this is the method is called as manual method, by palpating. And second method is there, that is called auscultation. As I told you, this is one of the tool. By using stethoscope we can auscult. So by using palpation, that is called as manual method. By using stethoscope, there is a one method is there, that is called as auscultation method. How it is goes, I will explain here. So this is exact the parts of the stethoscope. Yeah, so this is only the things. Place the stethoscope over the brachial artery. So here that only the differentiation in between the manual method and this auscultation method. While you're going to be ausculted, place the stethoscope diaphragm on the brachial artery, point it, note it. And second one is, when you're going to check the manual method, feel the pulsation on the radial pulse. Radial pulse is for the manual method. You will get the accurate data. And by using the stethoscope, place on brachial artery. So this is the depending on the sides of the arteries, we are going to differentiation in between two kinds of the things. So this is how you're going to feel it. The same how you felt the things by using manual method, the same thing you will get same sound kind of by using this auscultation method. And after procedure, the same thing. Go for hand washing, because you are infected, you're touching the patient, you're going to do the some procedure for the patient. Before going to that, must go for hand washing. After completion of the procedure also, whether it is manual, whether it is a whatever auscultation method also, you must go for this hand washing, because next you're going to touch one more patient. In order to prevention of, in order to break the chain of the infection, you must go for post hand washing also. Later that you just go for inform the senior sister or doctor, this is a reading got you after this thing. Then you must go for documentation. The documentation is very important once your procedure is getting completed. So whatever procedure you are going to complete, you must note it down on the case sheet. So that is a thing. My dear students, this is exact procedure of measurement of blood pressure. I hope you understood, because I too know the pain of the student. None of the student can't get the accurate data till now. I know that they feel some kind of problem while they're auscultating method, where we need to go for what kind of the data we need to, the blood pressure only assessing the person whether the person is a normal or abnormal. In that case, you are the medical person, you must check the blood pressure very accurately. That's what by this video I hope all the students understood how the assessment, how the feeling of pulsation of the blood, and how the feeling of auscultation, what is the differentiation, how we need to check. Yes, this is the thing I discussed for this session. My dear students, if like this you want videos, we are here, but your responsibility, your part is just like our page, share to your friends, subscribe. By that, whatever we are going to release the videos, whatever we are doing videos, it will come up to your level. So your responsibility you can do, and my responsibility, our responsibility we can do. By that the things will be good. So please subscribe and share. Until that, I will come next video with another topic. So please stay tuned. Thank you so much, my dear students.